Hello everyone, thanks so much for joining me today. My name is Lydia and this is Time with Lydia, the pharmacist. If you're new to this channel, a warm welcome to you, and to all our returning subscribers, thank you so much for joining me once again. Today, I've got some exciting news to share with you. Time with Lydia, the pharmacist has been accepted into the YouTube Partner Program. I just want to say a big thank you to you all for all the support in the past year. It's been an amazing journey. I have learned a lot and I'm sure you have also learned a lot. Thank you so much for the support. So, I don't know what you're waiting for. If you haven't yet subscribed to the channel, please don't hesitate to hit on that subscribe button and also on the notification bell so you don't miss any video that I upload. I have a lot of health topics lined up to talk about on this channel and you don't want to miss out. Today, I'm going to be spending some time with you talking about a very interesting topic. We are going to be talking about antacids. Most of us would have taken an antacid at some point in our lives, and today I'm going to be talking about how antacids work when we take them, some uses of antacids, that is what we take antacids for, some side effects of antacids, who can and who cannot take an antacid, and also I'll be sharing some precautions that you need to take when you are taking an antacid. Antacids are medicines that lower the acidity in your stomach content to relieve indigestion and heartburn. They come as a liquid or chewable tablet, and you can buy them from your local pharmacy or the grocery shop without a prescription. When antacids are used, they help if you have indigestion, if you have a heartburn or acid reflux, also known as gastro-oesophageal reflux disease or GORD for short. Antacids also help with stomach ulcers or gastritis, which is an inflammation of the stomach lining. They can quickly relieve your symptoms for a few hours, but they do not treat the underlying cause, and long-term use is not recommended. Speak to your doctor if you find that you need to take antacids regularly. Many different types of antacids are available. Some are sold under the brand name and others are named after the ingredients. In the UK, for instance, if you come to the pharmacy, you would see antacids under the brand name of Peptac, Gaviscon, Renis, and Pepto-Bismol, just to name a few. Ingredients that are found in antacids include aluminium hydroxide, magnesium carbonate, magnesium trisilicate, magnesium hydroxide, calcium carbonate, sodium bicarbonate. Some antacids also contain an additional substance. For instance, you can find an antacid containing an alginate, and the alginates do form a protective layer in your stomach. You can also come across antacids with ingredients such as simethicone, and simethicone helps reduce the gas in your stomach. When you buy an antacid, check the instructions. Read the patient's information leaflet so that you know it is safe for you to take it, and also you would know what dose to take. How and when should we take an antacid? What you need to do is check the instructions on the packet and read the patient's information leaflet to see how much you need to take and how often. It is best to use an antacid when you have symptoms or think you will get the symptoms soon. It's best to take antacids with food or soon after eating, because this is when you're most likely to get indigestion or heartburn. The effect of the medicine may also last longer if taken with food. Remember that doses in children are lower than for adults. Most products have few side effects when taken as directed on the label. Side effects are more prevalent when the product is overused or taken for longer than intended. Side effects associated with common antacids include diarrhea or constipation, flatulence, stomach cramps, feeling sick, or vomiting. The side effects should pass once you stop taking the medication. When antacids are consumed in high doses for a long period, then you can get a condition that is called acid rebound. This is when the stomach produces even more acid after food and drinks have been consumed. Speak to your pharmacist or your doctor if your side effects do not improve and they are very troublesome. You may need to switch to another medication. So who may be able to take an antacid? Antacids are safe for most people to take, but they are not suitable for everyone. Speak to your pharmacist or your doctor before you take an antacid if you're pregnant or you're breastfeeding. If you want to use the antacid in a child under 12 years of age, some antacids are not recommended for children. If you have a liver disease, a kidney disease, or a heart failure, some antacids may not be safe if you have one of these. If you have an illness that requires that you control the salts you take in your diet, antacids might not be good for you. If you have high blood pressure or cirrhosis, some antacids contain high levels of sodium, which could make you unwell. Also, if you're taking other medicines, antacids may interfere with some medications, so you need to be cautious. Now, I want us to talk about whether antacids are safe or not. When antacids are taken at the recommended dosage for short durations of time by people without contraindications, antacids are considered safe. However, antacids only relieve symptoms and will not cure the underlying problem causing the symptoms. This means they may mask some serious conditions such as gastric cancer. If you are taking antacids more than 2 to 3 times a week for longer than 2 weeks, you should talk to your doctor. Even if your condition is diagnosed as gastro-oesophageal reflux disease, other medications such as H2 antagonists or proton pump inhibitors that work by reducing or preventing the secretion of stomach acid rather than just neutralizing it may be appropriate for you. Also, some antacids contain sodium bicarbonate, which can affect blood pressure and circulation, particularly those with pre-existing problems. So high intakes of antacids that contain sodium are also not recommended for people with liver or kidney disease. Also, if you're prone to high blood pressure, you've got a liver or kidney disease, speak to your doctor before you take an antacid. Once you take an antacid and your symptoms are not going away, please do speak to your doctor, because some heart conditions like angina and heart attack have got symptoms that are similar to heartburn and indigestion. Antacids do affect the absorption of some drugs and they do interact with some medications. So it is also essential that before you take an antacid, you make sure you speak to your pharmacist or your doctor just to make sure that you are not taking any medication that can interact with the antacid. And remember also that antacids are not to be given to children less than 6 years old. They may also not be safe in people with certain medical conditions such as gastrointestinal bleeding, liver or kidney disease, or heart disease. Women who are pregnant or breastfeeding should also talk to their pharmacist or doctor before using antacids. I hope you have learned something today. Please give this video a thumbs up, share with your family and friends, and if you haven't yet subscribed to this channel, please do hit on the subscribe button and also on the notification bell so you don't miss any video that I upload. Thank you once again for your time today, and I hope to see you soon in my next video. Bye for now.